Hello, my name's Lee, and you're listening to Candor Conversations, where we have open and honest conversations about the care community at large. Today, I'm joined by George Appleton from Care England. George has had an incredible career at Care England, starting out as an intern assistant policy officer and working his way up to head of policy. George has had particular experience in demographic and epidemiological changes, which have informed the landscape of policy today. Hi, George, and welcome to Candle Conversations.
Thank you for those warm words. It's a pleasure to be here and to have the opportunity to speak to you today, Lee.
No problem. Could you tell us a little bit about yourself and what it is that Care England do?
Of course. So I'm the head of policy here at Care England and have been for the last year now, but I've been with Care England for over 3 years. This followed a background, as you already alluded to, in demography and epidemiology. So looking at the question of why we're getting older and whether that be in world trends in age structure, the causes and consequences of us getting older, and trends in mortality and morbidity, but also the more fundamental points of the biological factors underpinning all aspects of aging, as well as the wider context as to what the individual and societal implications of the changes in demography mean, particularly in terms of the policy implications for us, whether that be pensions, long-term care, health and social care policies. Care England as an organisation is really at the centre of many of those questions and implications. So, Care England is the leading representative body for independent care services in England. Our membership extends across single care homes, small local groups, national providers, not for profit providers, as well as private providers, covering a variety of services for older people, those with long term conditions, learning disabilities, as well as those with mental health problems. Care England as an organisation's mission is to ensure that the voice of care providers is heard among key actors and decision makers to help address the issues affecting the day-to-day operation of care services and help to improve the outcomes for all those involved across the system.
Brilliant. So today we're actually looking at the UK's ageing population. Now, the population of England and Wales has continued to age, with Census 2021 results confirming that there are more people than ever before in the older age groups. Over 11 million people, that's 18.6% of the total population, were aged 65 or older, compared with 16.4% at the previous census in 2011. What would you say the root cause is of the aging population?
So, as you just mentioned there, globally, we are getting older, but it's often not always understood why this is the case. And in essence, it's a result of population aging. Population aging is really a process and refers to an increase in the size of the older population of a country or region relative to the total population. So you can measure population aging by looking at increases in the percentage or increases in the proportion of an older population. Naturally, this brings about the question of what defines a quote unquote older population. The most internationally accepted definition of old age is those aged 65 and above. In terms of what the root causes of an aging population, so what drives a population to become older, it's two main factors, and those are changes in both fertility and mortality levels. When looking at fertility, your main indicator as to changes in fertility levels is the total fertility rate, or the TFR, which represents the number of children an average woman can be expected to have during her childbearing years. In more simple English and in layman's terms, this really means the number of children per family. Very much linked to the notion of a total fertility rate is that of a replacement rate. And a replacement rate represents the number of children each woman needs to have in order to maintain current population levels. The replacement rate normally sits around 2.1 in most developed countries. So, in other words, a woman needs to have 2.1 children in order to maintain current population size. When the replacement rate drops below 2.1, this is the initial catalyst for population aging. So it's initial a driver of what makes a population older, simply because there are fewer children being born and more people living into an older age category. So the cause of an initial shift towards an older population is the sustained downward trend in fertility rates. When looking at mortality, the key indicator to changes in mortality rates is that of life expectancy. And life expectancy is a far more easy concept to grasp, which represents the average period that a person may expect to live for. If we step back, though, and look at the wider context, population aging comes about as part of a demographic transition. So that's not a term. And a demographic transition represents the movement of a country's demography from one characterized by high fertility and high mortality rates and a young population to one where fertility and mortality rates are low and the population is old. A demographic transition is mirrored by an epidemiological transition, which represents a shift in mortality patterns and causes of death from patterns dominated by infectious disease to those defined or characterized by chronic and degenerative diseases. To unpick this just a little bit further, if we look at the history of the UK, pre 18th century, our society was characterized by the two main factors of population aging, fertility and mortality, both being at very high levels. So, in essence, people were having lots of children, i.e., the high fertility rate, but people weren't living long at all, and the periods of population growth were not sustained, i.e., representing the high mortality rates I just referred to. And this was very much being driven by the predominance of infectious diseases. And as we move through the history of the UK, we move through a period where in the mid 18th century, we see a significant reduction in those very high mortality rates, particularly being driven by infant mortality rates. And this was due to epidemics occurring less frequently and therefore an increase in average life expectancy. But these changes were likely driven by a host of factors or changes in the socioeconomic environment and cultural shifts, including improved living conditions and standard of living, increased sanitation, improved nutrition, less overcrowding, as well as access to medical and public health advances and interventions. As we move a little bit further towards the sort of 20th century mark, we see a decrease in the very high fertility rates, as I mentioned. There are different theories as to why this decrease happened, and fertility may have declined as the population became more aware of new information, such as contraception, but also the population potentially responding to the changing socioeconomic environment. So, children becoming less of an economic asset and more of an economic burden. But this period around the 20th century is particularly significant, as this is where population aging really begins to ensue and make its mark within the UK population, as this is where the very high fertility rates drop below that total fertility rate, or TFR, I mentioned earlier, and initially catalyzed population aging. So, as I referred to, because of the reduction in very high fertility rates, people having far fewer children against the backdrop of mortality rates falling. So, more people are being pushed through the older age cohorts, and thus, as a society, we begin to age. And finally, as a society now, the UK is currently experiencing the latter stages of our demographic transition, where the fertility and mortality rates are both very low. And in the current stage of our demographic transition, the primary driver of population aging is the low mortality rate, particularly the reduction in mortality rates in older age. So life expectancy is now very high, and the cause of death is primarily around chronic and degenerative diseases, such as those induced by diabetes and dementia, for example. To put this into layman's terms, I suppose, we've roughly seen around a 10 to 15% increase in the percentage of adults aged 65 and over between the 1900s and present day. So in 1900, only around 5% of the population were aged 65 and above. Today, this is around 20%, so a fifth of the population. But what's really significant is that by approximately 2045, so around the next 20 years, almost 25% of the UK population is going to be aged 65 and above. So potentially within the next 20 years, a quarter of the population within the UK will be aged 65 and above and therefore considered old. And if we look at life expectancy, this has again increased dramatically. So in the early 1900s, a woman at 65 could expect to live for a further 12 years, whereas by 2025, so a few years from now, this has increased to approximately around 22 years and will continue to rise again, but by about 2 more years by the time we hit 2045. So enormous shifts, Lee, in both our demography and epidemiology, and enormous policy implications for those.
You're talking incredible numbers there. That's a huge percentage of the population shifting. How is that, or how is this currently affecting the care sector?
Yeah, it's a really good question, and one that sort of ties to what all of this means for the social care system. And this question is really rooted in whether these extra years that we've gained in life expectancy are going to be spent in good or poor health. And speaking very broadly and based upon current projections within England, there will likely be an expansion of health related problems. So, by health related problems, I mean disease and functional limitations, primarily because of the increase in the total number of people aged 65 and above. And these health problems will likely be delayed into later life. So, there's going to be an expansion of health related problems, but a compression of severe morbidity into the final few years of our lives. And this compression of severe morbidity and these health problems will largely be the likes of arthritis, diabetes, strokes, and dementia. But understanding population aging and these challenges it presents is critical for all those involved within the sector, ranging from national government right down to local care providers themselves, as it's essential for understanding what the future demand and supply of care services will need to look like. In terms of your question, Lee, in terms of how it's really affecting the care sector at present, population aging is manifesting itself in a number of ways already and creating issues not limited to the likes of fiscal and budgetary pressures. So, against the backdrop of a rising demand for care, local government has lost nearly £15 billion in central government funding in the last decade, and many councils continue to face significant challenges when trying to set budgets and protect local care services from further cutbacks. And local authorities are increasingly reliant on local taxation and short term and unsustainable funding sources. Naturally, the years of significant underfunding, coupled with this rising demand for care and costs for care, they've combined to push adult social care providers to breaking point in some situations. And many of these pressures have been exacerbated by the likes of the COVID pandemic. Wider issues which are manifesting themselves right now include issues around quality and access to care. So, around 540,000 people are estimated to be waiting for assessments, care, direct payments, or adult social care reviews. And even before the pandemic, which has now been exacerbated, there was already significant local variation in access to care and service provision, with much of this variation unexplained and unwarranted, which comes back to this term which you may well be familiar with, of a postcode lottery for care within the social care system. Wider issues currently include the likes of workforce challenges, and this is a big one and one that I really want to focus on throughout the rest of this conversation. There's an increasing demand for care, whilst the workforce, both those providing formal and those providing family or unpaid care, is likely going to keep pace with this increasing demand for care. Unfortunately, the likes of poor pay and employment conditions in social care, which many of which are beyond the control of adult social care providers, as it's very much dictated by local authority fee levels, for example, they've consistently affected the size and structure of the workforce. And against the backdrop of underfunding and a growing demand for care services, addressing these issues is becoming increasingly challenging. However, that's not to say that an aging population is a time bomb necessarily, which we're unable to address or even take advantage of. There is huge potential within our growing aging population owing to transitions in both demography and epidemiology, but it's now incumbent upon us to look pragmatically and proactively at what we can do to take advantage of some of those opportunities.
So these are effects that are actually happening in the industry right now, causing all sorts of problems. If
Mm.
we don't do something about this, what will happen?
I think that's a pretty multifaceted question, I suppose, but I think perhaps one of the primary ones is the uncertainty around whether this demand for care can be met. So demand is being driven by the increasing number of people, as I've alluded to, over the age of 65, which in turn drives up the total number of people with a physical disability and other vulnerable people who are more likely going to need some form of social care service. But as a result of the changes in both demography and epidemiology, so people getting older with increasingly complex conditions, this demand for different types of social care services will only increase. So we've seen an increase, for example, in the likes of home care provision and supported living services over the course of the last decade. That's not to say that that's of course to say, sorry, that there will likely remain a huge demand for residential care, either with or without nursing, as people will likely continue to see increasingly complex conditions, which can only be met in these specialist services. But the workforce itself and social care system as a whole, in terms of the portfolio of care services, needs to be able to meet this demand, both from a supply perspective, but also from a demand perspective, in terms of being able to shift the models of care to be able to meet this increasingly old and potentially vulnerable population, but also be able to train a workforce which is able to meet the needs of these individuals. The other big issue is the gaps within the workforce. So, as I've already mentioned, it's no surprise that the supply of available workers is substantially lower than the demand. So, there are currently around 165,000 vacancies just across social care. And if you look across both health and social care as well, there are around 300,000 vacancies, which roughly equates to the population of Newcastle. To come back to the social care issue of the workforce, over the last year, that vacancy rate of 165,000 represents an increase of 52%. So a huge increase in the number of vacant posts. And broad projections estimate that the number of adult social care jobs will need to increase by around 29% to 2.16 million jobs by 2035 in order to keep pace with our aging population. So we as a sector need to increase our workforce effectively by a third within the next 15 years or so, just to keep pace with the aging population. So a huge ask in terms of being able to ensure that some of society's most vulnerable are cared for at the right time and in the right place. There's also an added nuance of the workforce itself within social care is aging. So the social care workforce roughly sits at around 27% being aged 55 and above, when compared to 20% of the wider economically active population. So this accounts for around 410,000 jobs in adult social care. And from a workforce planning perspective, these workers are more likely going to retire within the next 10 years. So another layer of complexity which could have huge implications for the delivery of care. It's also worth picking up on the slight dynamic and nuance of informal care. And by informal care, I'm referring to the supply of unpaid or care provided to a relative or a loved one. This is also under question, and there are several factors which relate back to demography and epidemiology affecting the social care workforce from an aging perspective. So, in terms of the first area, I suppose it's the reduction in fertility rates. And as I already mentioned to you, Lee, fertility rates have been decreasing over the course of the last century or so, meaning that those now in receipt of care typically have smaller families and therefore a smaller network of people to rely upon to provide care. There's also been an increase in the likes of childlessness. So, roughly around 1 in 5 women within Britain can expect to reach the age of 45 with no biological children. So, naturally, that reduces the number of people able to provide care in older age, and therefore they're more likely going to require or tap into the social care system as a whole. However, that's at a bit of a grey area. The reduction in fertility doesn't necessarily mean a reduction in support for those in old age. Naturally, the improvements in old age mortality, so the improvements in life expectancy, have increased the survival rate of spouses and siblings, which is actually added to the support network of older people. And research broadly indicates that a married person, for example, has significantly lower rates of being admitted into a residential or nursing home as a spouse support, for example, someone who's divorced or widowed, for example. There's also been some interesting changes in family structures and relationships. So this slightly muddies the water and complicates things slightly to an extent. But there have been changes in family structures and relationships. So, for example, the number of divorces in England and Wales saw its largest percentage point increase in nearly 50 years back in 2019. And evidence broadly suggests that widowed, divorced, and never married adults have a high risk of long-term care admission. It's also now uncommon from a family structure perspective to live with multiple generations in the same household, which naturally reduces the level of immediate support. So, for example, if I'm living with my parents or their grandparents, for example, I'm able to act as a degree of social care support in some respects. But in the context of old age support, back in, for example, the 19th century, there were a high number of older individuals living with a child compared to a relatively low number now. There are also significant changes in participation rates in the labour market. So, one of the most consistent findings amongst contemporary research is that women provide far more family care than men. So, female caregivers provide more hours of care and are more likely to provide personal assistance to a loved one or to a family member. However, given the continuing rise of female participation rates in the labour market, it has naturally produced concerns around the number of people available to provide family support in the future. So, I actually can appreciate across both the formal social care structures and both across the informal social care structures, so that provided by a family member or a loved one, the workforce demographics are immensely complicated, but Care England continues to work with government and wider stakeholders to try and tackle these issues currently afflicting the adult social care sector. And we want to work with both local and national government, as well as our own members, to ensure that we get this right, as ultimately there are only going to be a few bites at the cherry before this manifests itself in really tricky issues for care providers to try and deal with. And as I've already mentioned, some of those issues have now come to the doorstep of the social care system, and we're looking to work pragmatically, proactively and collaboratively with all system partners to ensure that any negative implications are mitigated to the best of our ability.
Fantastic. That's a really comprehensive answer. Now, we're talking about things that are happening right here, right now. We're also looking at the future itself.
Mm.
What actions can care homes or training providers take right now to address this?
So, as I mentioned, this is not a time bomb that can't be tackled, that can't be capitalized upon. And I certainly don't want listeners to go away thinking, crikey, this really is an issue that we're facing now and that we can't look to try and address. Naturally, with any sort of problem comes new challenges and opportunities. As we've seen, people are living longer and with a host of complex conditions, and the social care system and the workforce and providers must reflect this reality. So we need to ensure that there are the right number of staff who are equipped with the right skills and have access to the latest technology to meet the needs of the people they support now and in the future. This means increasing the number of people in the workforce, making sure that the right people with the right behaviours and the right values are attracted into a career in social care. And naturally, with an increasing expectation and demand for personalised and integrated care, we require new ways of working and more flexible working as well within the workforce. So I think working pragmatically to recruit and retain staff is an issue which is far easier said than done in some respects. And I think we are, as Care England, working with many sector partners in terms of domestic recruitment. So, if, for example, you look at the Department of Health and Social Care as a national partner, they've launched the Made with Care campaign, which care providers are welcome to tap into and try and take advantage of to try and promote job vacancies and ensure that the right number of people and that the right people come into your service. We're also working with wider sector partners, so apps and technological developments like an app called Care Friends, who have recently partnered with Care England, which looks at effectively a refer a friend scheme that the social care workforce can let's take advantage of and providers can take advantage of with great success. There's also the international recruitment route, and naturally there are barriers to international recruitment, but it's becoming a more viable route for providers to try and tap into to try and plug that very high vacancy rates. And from international staff, there are huge opportunities. For example, we've recently partnered with Sri Lanka. And there's a huge number of Sri Lankan staff able to come and provide a very high level of care. They're trained, they're ready to go. You just need to speak to the right people in some respects. And we as Care England can facilitate those conversations about bringing the right people over to your workforce to ensure that you have a workforce appropriate to meet the demands of this aging population, but also about internal practice and looking to revise your internal policies. So, to pick up a point I mentioned earlier about adapting to this aging workforce. So, over the last 20 years, the number of over 65s who are employed within the wider UK economy has increased by 188% to around 1.3 million. That's a huge number of people now employed in quote unquote old age. So, increasing the number of over 65s in the workplace unlocks enormous potential for employers to embrace a talented, flexible, and highly skilled workforce. But it also requires many employers to change their current practice and reconsider how they engage with and attract talented older employees. So, policy responses, for example, need to focus on empowering those older employees currently within your workforce. For example, studies have highlighted that many older workers would remain in the labour market if they could work more flexibly. Therefore, employers should look to potentially within a social care environment, look to increase work flexibility by, for example, relocating workers who are struggling with the physical demands of social care work into a more relationship based care role, or looking at prioritizing potentially what these individuals can do within your service in terms of the reduction of physical activity, for example. But research positively generally indicates that staying in work for a few more years in later life can make a significant difference, not only to someone's income, but also their physical and mental health in later life. So there are certainly health benefits from staying in the workforce for a longer period of time, too. In terms of the wider implications, the social care sector is fundamentally interconnected with the health of the UK economy. So, as I mentioned earlier, the number of jobs in social care will need to increase by around 29% by 2035. So, the sector will play an increasing role in the UK's economy. But if this is to be successfully realised, government action is indeed required to address the underlying issues that I've already alluded to. Currently, the level of employment in adult social care represents 6% of total UK employment within the UK. So we are one of, if not the largest single employer across the UK, and we contribute roughly around 2.6 million jobs and 46 billion pounds to the UK economy. So we're fundamentally intertwined with the health of the UK economy. So if the UK wants a healthy economy, you need to address some of these really deep rooted and systematic issues within the social care sector. Positively, and naturally, it's sad though it is to receive recognition through the likes of a pandemic, the social care sector has never been so publicly or politically salient. And now, off the back of the pandemic, the government has published a raft of mutually reinforcing reforms. So that's the Adult Social Care Reform White Paper, People at the Heart of Care, the Health and Care Bill, and reforms to the public health system around the funding of adult social care. But perhaps if we look at workforce, for example, perhaps the most prudent of those in relation to the workforce is the likes of the £500 million, which was due to be generated through the Health and Social Care Levy, which has now subsequently been scrapped. But that's aimed at improving recruitment, retention, progression, and staff well-being. And whilst it's clear that the ambitions of government are well founded in terms of, for example, establishing a knowledge and skills framework, funding for care certificates, continuous professional development budgets, mental health and well-being supports, for example, £500 million is merely a drop in the ocean in terms of what is required to be successful in terms of addressing some of these fundamental issues. And Care England has remained very vocal in this space, working collaboratively with both local and national partners to ensure not just this £500 million allocation, but some of the wider government initiatives and some of the local initiatives are not just a symbol of tokenism, but catalyse meaningful change on the ground for care providers. Something which we're doing in March of this year, our conference is aimed at thriving, not just surviving. So we're really bringing a light to how providers can proactively look to thrive in this very politically and socioeconomically turbulent time, and look to try and bring to the fore this level of good practice, these creative ways of thinking, and ultimately, hopefully, putting social care on a more sustainable footing going forwards.
Absolutely fantastic. Huge thank you to you, George, for being a guest today. I think you've given our listeners an awful lot to think about. Thanks ever so much for listening to Candle Conversations. We hope you enjoyed our deep dive into the ageing demographic. And you can actually find out more about Care England by heading over to their website, which is careengland.org.uk. That's all for this episode. See you next time. Thank you. George, that